All right. Welcome again to tonight's webinar. My name again is Dr. David, and we have Terry Watt with us, who's going to take us through the practical steps of learning how to help of helping people who are going through cancer. I mean, all the nitty gritty. And I tell you, I've looked at the slides, and I'm really impressed with what has been put together. Simply, not just because it's such an important topic, but also it's because, like I said earlier on, cancer is a multidimensional disease, and we need to know the different, especially for people who are going through treatment. We need to know what they're up against. We need to know how best to support them, because in my experience, and I think I've mentioned this to you before, when I was treating cancer patients, the people who survived, people who did well, were those who had great support from their families. As a matter of fact, those who did not have support, you could tell the difference night and day. Those were the ones who succumbed very, very, very quickly to the disease. And there is a lot to be said for good social support, especially in life-threatening conditions like cancer. And Dr. Siegel, Bernie Siegel, has done a couple of presentations for us on the topic, and he deals mainly with the philosophy and the thinking and the heart and the will to live and those other things that deal with psychology. Are very, very important, but yet there has to be a place for people to know the practical things in addition to having the will to live, the will to survive the cancer. You've got to know what you need to know. You've got to know what you need to do in many instances. What happens when you're having a reaction to a certain drug, for instance, or what happens when you become so weak you cannot even stand because of the treatment. What do you do in such situations? How do you avoid those things so that you can complete your treatment? I think these are all things that have to be addressed. And again, that's why I'm so glad that we're going to have someone like Terry to do this. And she's going to tell you about her background. And she has people in her family, very close members, who have gone through the disease. And so it's more than just a profession for her. It's a personal thing. And I just want to say, I'm going to hand this over to Terry so that you can put things together while I say a few things about her. And then, of course, like I said, Terry is going to do her give you more about her background and share with you why this is such a passion to her. So I'm going to hand this over to Terry while she's working on this. Terry, let's go ahead and click on that. Are you there?
Okay, yes, thank you.
Hang on just a minute. I'm going to get you. Just make sure you're all fully situated.
Okay. Are we ready?
How are we doing? Okay, excellent. That looks great. You've got it all up. And like we said earlier, we're going to be going back and forth. And why don't you just go ahead and just give us an introduction about yourself? I think you do it probably better than I could ever do, because I mean, your story is a fascinating story. So please go ahead, and I'll just chime in from time to time.
Okay. Well, thank you. Give me the opportunity to share this.
Is it still echoing?
Yes, I do know that.
Okay, go ahead.
My background, thank you again, Dr. David. I don't know if you could hear that before, but thank you for the opportunity for letting me share this. My story is that my father died when I was 7 years old because he had esophageal cancer. So I guess that might have been one of the reasons why I thought of nursing as a career. And when I graduated high school, that's exactly what I did. I went to nursing school and decided to enter the nursing field. Before I had children, I worked on medical surgical floors, and I also had cancer patients on those floors as well. Then when I did have children, I decided to be a stay-at-home mom, and I homeschooled them for a while. So that's my passion for education as well. And then I took a refresher course. Once my kids entered high school, I thought, okay, well, I'm ready to go back into the workforce again. But just about the time when I finished the class and interviewed and got a job, at that time my mom became ill. and it was real obvious. Well, she'd had medical problems up to that time, but at that point, it became obvious that she was not going to be able to live by herself. My sister was as a teacher, so she would work during the week, and I would take care of my mom, and then on the weekends, when I was at work, my sister would take my mom. And so that's how I ended up getting back into nursing again, was just working part-time. But when I went back back to work after my kids, I did work on a cancer floor. And so I've been there for 9 years, and then after that I have gone into working. Now I'm doing what they call care management, which is really a fun kind of way of doing it. I actually call patients in their homes and check up on them. These are patients that usually have had their chemotherapy, and then they have to go home. And so we check up on them and see how they're doing with their symptoms and the other things. And this actually is going to be the trend, I think, because of insurance. It doesn't really cover patients to get their treatments inpatient anymore, or as much. So I think we're going to see more of a trend this way, and more patients are going to have their family to help them through the process of the side effects of chemotherapy and the side effects of their treatment that they have. So I'm ready to get started. That's my story. So let's just go ahead with this webinar now. So we're going to talk about taking care of a loved one with cancer, what to do for the patient, and I also want to include what to do for the caregiver at different stages. So we're going to talk about 4 different stages. The main stage I'm going to talk about the most is the treatment stage, because there's just so much that goes into that stage. But I wanted to bring up some of these other stages because these are stages that people really do need support in as well. And it's often difficult for both the caregiver as well as the patient to go through the stages as well, together. It's important for them both to understand those stages. So the first initial diagnostic stage is what we'll talk about first. The second is the treatment stage. The third is the survivorship stage, which we'll talk about more, and then the terminal stage. So let's go ahead and get started with the initial diagnostic stage. The patient and caregiver at this stage often feel great uncertainty. They feel fear, they have sadness, feelings of helplessness or no control. Maybe they're going through the diagnosis and they're worried. They don't know if they're going to have a positive outcome from their test or a negative outcome with a diagnosis of cancer. And then what feeds that fear and uncertainty too is just a lack of unknown about the cancer itself, about the diagnostic tests, about the staging and the treatment options. Okay. So I'm going to talk about a little bit about some of the things that you want to know when you are in that first stage and you're trying to figure out. One of the reasons that you have lack of knowledge of cancer is people don't understand what it is. And I just want to share that with you a little bit. Basically, cancer begins in the cells, the building blocks that form the tissues, and the tissues that make up the organs of the body. These abnormal cells act differently than normal cells. The functionality of the normal cell is lost. And instead, you have them not functioning the way they were meant to. You have them dividing. And I'm going to show you the next slide. It's going to be a slide that shows some of the different things that they do. Normal cells, they stick to the tissues that they're meant to stick to. So if it's a colon tissue, they stick to those tissues. If it's a lung tissue, they stick to those tissues. Whereas a cancer cell, especially at the later stages, they don't stick to where they're supposed to stick, and they travel. The other thing is that they divide. A cancer cell will divide abnormally, whereas a normal cell will only divide, it divides a certain amount of time, and then after that time it dies, and then it replaces itself. But with cancer cells, they are functioning abnormally, and so they continue to divide and reproduce and reproduce and reproduce. this one here just shows the difference between benign tumors and malignant tumors. Benign tumors here are not cancerous, but they also have lost some of their functionality, the way they're meant to function. And so these tumor cells grow only locally, and they aren't able to spread. Now, many people will say, oh, good, it's benign, and that means they can get rid of it, and it doesn't have any cancer characteristics. But when it's a malignant cell, they can start out differently. They can be local, or they can be starting to spread into the surrounding tissues, or they can be spreading through the bloodstream, through the lymph system. The next show. Okay, now we're going to just talk about staging during the initial diagnosis stage. And here, you know, what we're doing in the initial stage or staging part of this is we're finding out where the location of the primary tumor is. If they cannot decide, if from the cells they can't see what the tissue looks like for instance, your colon cells look like colon cells, your heart cells look like heart cells, your lung cells look like lung cells. But if they do not know, if the cells have changed so dramatically, then they will sometimes say that your cancer is of an unknown primary, meaning that they don't know where it started. But if they know where it started, then they know that it's one of those tissues. The tumor size and the number of tumors is also figured out during the staging period. They determine if there's lymph node involvement or not. And what that means is that if there's lymph node involvement, it's gone past the initial stage where it's small and localized, and it's starting to invade the lymph node area and traveling more. Also, the cell type and tumor grade is checked. And then there's other organs that may have cancer cells, and and then that is shown whether it's actually spread or not. So again, here's just a real quick visual of stage 1, very local. Stage 2 would be local but starting to spread. Stage 3 is starting to spread further. Stage 4 can be starting into maybe the blood system or the lymph system or some other kind of areas. And then stage 4, it's usually in other organs or somewhere else in the body besides the primary place that it started. All right, the second stage we were going to talk about was the treatment stage. And I said that this stage is where I'm going to probably be spending more time. In the surgery stage, again, it can be a very, surgery in itself can be very worrisome to many patients and stuff, but learning what to expect with surgery, how to cope with after surgery are all things that hopefully, the care people that are going to be doing the surgery is going to be teaching you about, so you know how to recover best and you can do certain things that will help you. Nobody really knows how anybody will respond to treatment. And during this stage, if you're the caregiver, if you're someone that's trying to come alongside and help support someone, then you can be a gatherer of information. Search for your loved one's disease online. Ask your cancer center for information or take notes. Ask questions at the doctor's appointments. Those are all great things that can help. And then the most important thing, too, is also deal with your own feelings first. Because as you work through, some of the issues, you'll be better prepared to help the person that you're trying to help.
Now, Terry, I had a quick question. I had mentioned this, and this has been my experience. But in your experience, what difference does it make, or how much of a difference does it make, if the person who has just been diagnosed with cancer has loving support from the friends and family?
I really feel it's critical to have that support. It can be a very, scary time because you imagine the worst. You feel like, and it just helps to have someone there that is supportive and maybe helping you think more positively about it. I'll never forget the time that someone said to me, because my mom had lung cancer, and I was thinking the worst, and someone said, well, she isn't dead yet. And at first I was kind of angry. How dare you talk to me like that? But then it made me realize, that's true, she's not, and I should be enjoying each day that I have. So, and it turned out for her, it turned out very good. It was a localized cancer, and so it was, sometimes wounded phrases can be helpful as well. So, yeah, so I feel it's very helpful. Okay, I think another thing too is that everybody be honest with each other and open and supportive. If we try to hide the feelings, or if we're trying to hide a diagnosis or trying to keep things, I think it's more difficult because you're not able to really express your feelings or explore those feelings as well as when you can talk about it with other people.
Right.
All right. So there's different treatment stages. Let me back up. There's surgery types of treatment. There's radiation. Then there's chemotherapy, and then there's other different things that are similar to chemotherapy in that they're given maybe something intravenously, but they're coming out with new research all the time. Some of them are biotherapy types of treatment, and that's supposed to really help support the body's natural functions, such as increasing your white blood count or other things. So there's some others, but I'm not going to really go into a lot of detail on there. And radiation, I'm just going to skim over a little bit. So all patients require time to heal. And I think that many doctors will say, okay, now your body has to do the work after they do the surgery. It's the body that's going to have to do the work to bring about the healing once the surgeon has tried to take out what isn't supposed to be there. And so it's important that you support the body to do its own work. So good nutrition is important to restore the cells. Waiting for the results of surgery and adjusting to the diagnosis can be a trying time. And also you may need help with the physical changes from surgery. If there's something that's going on, maybe you've had to have some of your colon taken out or some of your lung taken out or something like that, then you've got to have some periods of adjustment to those types of changes. Some things you might want to do, which are really good things to do, is hold regular family meetings. Keep everyone involved. Use these meetings as updates and maybe care planning sessions. Maybe have times where you can adjust to your schedule so that everybody's able to be accommodated. I remember one time my son said, does Grandma have to come with us everywhere? And I was like, well, yeah, in some ways he does. So, but then I got to thinking, well, I need to be able to try to make some time when I can be with my son on one-on-one when we leave the house so that he has that time. So those are kinds of things you need to work into the scope of the care. You want to keep the openness of sharing thoughts, feelings, and questions. And it's always really a good idea to make a list of the responsibilities that need to get done on a weekly and daily basis. And that way, maybe there's other people that can, the family, number one, can look at the list and say, okay, I can do this or I can do that. Another thing is if you have other people outside the family that are offering help, then you have a ready list to be able to say, well, which one of these things do you think you'd like to do? And that would be great for you to step up and do those. Okay. Okay, so I'm going to just basically speak real quickly about radiation because I'm not an expert on radiation. The radiation oncology team is usually an excellent team. They know tons about it. They have lots of information they can give you. If there's side effects from the radiation, there's creams that they can recommend, and they usually do all of that in the department where I am. So you can always ask your radiation people that are working with the patients to look into that. But it is interesting that radiation has come a long way. It used to be that they would radiate large portions of the body, and now they can really zero in very specifically into the areas that they need to deal with. What's good about that, too, is that there's less side effects when you can zero in more specifically to the cancer. Side effects are really related to the organ that it's closest to. So if it's your GI tract, your gastrointestinal tract, you might have nausea, vomiting, you might have some different kinds of things like that, or you might have just skin irritation from the radiology. But it depends on, where the radiation is closest to, because it's very specific. Again, what it does is it's the main reason that you get radiation is it's supposed to kill the rapidly dividing abnormal cancer cells. Okay. Okay, now the treatment stage, how does chemotherapy work? Well, these are drugs that are used to kill cancer cells. They work by stopping or slowing the growth of them. And your main goals are either to cure cancer or control cancer or ease cancer symptoms. The treatment side effects are the problems that are caused by the cancer treatment. Patients may have a lot, or they might have a few, or they might have no side effects. It really depends on the patient and how well their body is, the constitution of their body is built. And if they have a well-built and well-taken care of constitution in their body, then I think they're able to have a better outcome. How long the side effects last depends on your health, your diet, and your activity level, and the type of treatment you receive. So understanding the effects of treatment can help the caregiver anticipate the needs of the loved one, and so that's what we're going to be talking about now, are the different kinds of side effects. Most of the side effects can be managed, and the doctor will monitor the side effects during the treatment and prescribe treatment as needed. And if you need more information on the side effects, you can refer to the National Cancer Institute, and you can get a booklet that one of them is called Chemotherapy in You, and so that's an excellent resource. You can also, and then we're going to be talking about it right now too. So one of the first, well, what I've done here on this slide is I've listed almost all of the side effects you can have from chemotherapy, and we're going to talk about each one, not all of them in real detail, but I'll talk about the ones that are really most important. The first three, the neutropenia, anemia, and the thrombocytopenia, all have to do with your blood count and the changes in your cells. So we're going to talk about that first. The neutropenia are white blood cells. Well, actually, neutropenia means low white blood cell count. Now, the purpose of blood cells, of the white blood cells, is to protect your body from infection. So when you have a normal amount of white blood cells, they're in your body fighting the infection all the time. And so if you have the normal amount, then you're doing well, you should be healthy. If you have a high level, it's a possibility that you have an infection. And if you have a low level, it's a possibility that you won't be able to fight infection very well. So one of the problems with chemotherapy is that it actually lowers your white blood count, or can lower it. And so the caregiver needs to really be attuned to watching for the side effects of having a low white blood count. And even before you might have one, you want to take steps that help minimize the infections as much as possible. So helping with the cooking and cleaning helps, because you're not going to, maybe cut yourself. You're going to be able to be free from that. So the patient will be able to not have to. You don't want to feed the pets, because you could be exposing yourself to more germs or more things that you don't need to be exposed to. Hand washing is very imperative. It's so important. I can't stress that enough. You really want to make sure that you are not transferring a lot of germs. If the patient should show any of these signs, like an oil temperature of even of 100.5, 100.5 or greater, that's a low temperature. But with a cancer patient, if they don't have any white blood cells and they're having a temperature, they're not going to be able to really fight the infection. So even for a low temperature of 100.5 or greater, it's important that you get to the emergency room and you let them know that your loved one has had cancer treatment, has had chemotherapy, and it could be, you know, a sign of infection, and you need to get them checked out. And usually checking them out means maybe getting a urinalysis, some blood cultures, or maybe even a sputum culture if they're coughing or something like that. So chills is another sign that the patient might be having a fever, even if, or could be having some sort of infection, even if they don't have a temperature. If they have diarrhea for more than 2 days, cough or sore throat, burning and painful urination, or flu-like symptoms. So you want to make sure that they're healthy. And also, because of the great risk that chemotherapy causes to decrease your blood cell counts, it's imperative really most of the time to get weekly blood tests. Now some chemos might not require it, but that really is your doctor's choice. You know, he's the one that has to decide whether you can get it with that particular chemotherapy or not. So you can ask your doctor if you need those weekly blood tests. Okay, the next stage is anemia, or what we call a low red blood count. The red blood cells in your body, what the purpose of them is to carry oxygen around your body. So most of the time, if you have a low red blood count, the signs are going to be that you're fatigued because you don't have very much oxygen running around your body like it's supposed to be taking a ride on those red blood cells. You're going to have weakness, dizziness. You're going to look pale. So again, take those weekly blood tests and make sure that they're in the range that they're supposed to be. And those signs are good signs for the caretaker to look for to see if this is a problem or not. And then there's certain levels. If you have a hemoglobin of 8.5 or less, the doctor may say that you need a blood transfusion. So that would be important for the caregiver to know as well, and to know that they need to make sure to call the doctor for that. Okay, the next one would be what they call low platelet level, or thrombocytopenia. What the purpose of platelets is to clot the blood. If it's too low, you're not going to clot your blood and you could end up bleeding too much. So depending on the count, the doctor may decide to hold the chemo if it's too low, or he may decide it's fine to go ahead with. So they usually like to watch this platelet count. Some of the signs that a caretaker can watch are bruising, bleeding gums when brushing teeth, blood in the stools, nosebleeds. So if they have like one and it's not too bad, then it's okay, you know. But if they're having consistently bleeding gums every single time, it gets to be too much, or there's lots of nosebleeds, and you just think it's really out of the norm. Sometimes dry air can cause it. Sometimes other things can cause it. But definitely, if you're seeing multiple signs or too much of this, then you need to make sure that lab is done, and may need to take the patient to the emergency room if it's out of control. Okay. This slide, a lot of people don't even, they think maybe the gastrointestinal tract is really the stomach and the intestines here. And that's really what it means, gastrointestinal. But what a lot of people don't think of is that this esophagus and your mouth it's all really attached. And the reason why I want to bring this up to your attention is because chemotherapy loves to work on these rapidly. These are rapidly replacing cells. just like the cancer is rapidly, growing. And so the chemotherapy isn't always as selective as we'd like it to be. And these are the cells that are most affected. So what sometimes can happen is you can have taste changes in the mouth. You can have taste changes. You can also have mouth sores. And those mouth sores, some people think, oh, I got these mouth sores. Well, sometimes if the sores are happening here, it's possible they could be happening all the way through the entire gastrointestinal tract. And so if you think about that happening, you can think that the appetite's not going to be as good. You can think about all kinds of things. The absorption of nutrients won't be as good. So it's important that, that you're aware of what's going on with this whole GI tract. The other thing is that nausea, vomiting is very prominent. It can happen a lot, but there are drugs that help to treat it and to control it and to help the patient to undergo the therapy, the chemotherapy treatment more easily. The other thing that can happen is diarrhea or constipation. So there's a lot of different things that can be done. Again, looking at that cancer chemotherapy booklet from the National Cancer Treatment Center or National Cancer, the reference I mentioned before. If you look there, they'll have a lot of good information. But dietary modifications, like for instance, if you're having a lot of diarrhea, you can use what they call the BRAT diet. And a BRAT diet is bananas, rice, applesauce, toast, tea, and tapioca. And believe it or not, those are all different types of things that can be more constipating or can kind of help to bind up. So those are ways that you can do it. If you're having constipation, you might want to eat more fruits and more things with more fiber and that kind of thing. With nausea, with any of these, small frequent meals might be necessary. If you have mouth sores, bland foods are very important so that you're not irritating it with spicy foods. Sometimes cooler room temperature liquids helps. Mouth care is extremely important because, again, the more you can keep your mouth clean, the less chance of infection developing, less chance you have of having that infection develop. So mouth care can include mouthwashes that don't have alcohol. You want to make sure it's safe from alcohol because that can actually irritate mouth sores. And then, of course, the medications that the doctors prescribe to help with the side effects. There's medications for diarrhea, there's medications for constipation, nausea, vomiting, and there's medications for mouth sores. So those are all.
Terry, I wanted to mention, too, here that Dr. McAnally will be speaking tomorrow about his technology that specifically can be used for cancer patients who are having mouth sores. And it's an aloe product, but it really helps the mouth to heal quickly and takes care of the infection and all that. So, and apparently it's FDA approved, so it has been used quite successfully for cancer patients undergoing treatment.
Okay, good. All right, the next thing we want to just talk about is that most people automatically think with chemotherapy, they think hair loss. And what's really wonderful today is that we have such good things. This is actually a person that has a wig on, and you would never think so just looking at this beautiful picture. Here's a person with a turban, and that really looks very becoming, and it really helps the self-esteem of the patient to be able to get these things and to be able to, if they've lost their hair, it helps them to feel better. The other thing that these things are good for is that it helps protect the scalp, which is also important, because if you do get a cut on the scalp or there's some sort of irritation going on there and you don't hydrate it well, you could end up having more problems with possible infections. And with the nails as well, sometimes the chemotherapy can be very drying to the skin and the nails. So you want to make sure that you're taking care of them well. And one of the things you don't want to do is have artificial nails because evidently there can be infections that can develop underneath the artificial nails. Okay. And again, not everybody has hair loss. Sometimes there's no loss. Sometimes it's just hair thinning. and sometimes it all falls out. So it just depends on the person and how they're going to deal with it. So lotions help relieve the dry skin, mild soaps are important, and wear protective clothing. Make sure you don't get sunburn or the other things. And if you have any rashes, they always should be evaluated by a doctor. And then, of course, this slide really shows how people can feel after chemotherapy. Fatigue is a big issue. So as a caretaker, it's real important for you to be aware that the patient's going to maybe need some more rest periods, maybe take activity little by little, have activity interspersed throughout the day with rest periods. And then also be sensitive to the patient, because this might be a time when they would just like to be left alone, and it's not to be taken personally. It's just that they might need a greater amount of rest and time to just kind of zone by themselves for a while. And then other times when they're feeling good, then that's a good time for the caretaker to know that maybe you could do a little fun project or get the family together. Maybe you can sing songs. Actually, what we did with my mom one time was we just sat down and we sang hymns to her when she was feeling better and she was in good spirits, and we could do that for her. But it was something she liked to do. It was something she wanted. All right. So fatigue and tiredness and weakness can be real problems. And some of the things that can happen with this fatigue and tiredness too and weakness is potential for falls. So you really have to make sure that you're watching for that as well. But there's a lot of things besides the chemo too that can contribute to that. And that might be anxiety, just all the tension and worry about what's going to happen, how things are going to turn out. That can be a great stressor and can contribute to this. So the less the more positive you can be, the better. And same thing with depression. It really does have an effect on the body. Pain issues, if you don't keep that pain under control, that can be a problem. Lack of sleep, stress, lack of activity, poor diet, and low hemoglobins, which we talked about with the blood testing. So all of these things, if you just look at these and think, okay, what's the opposite of it? How can we help this person not get into these little things? Make sure they get sleep, make sure their pain is controlled, make sure that they maybe watch a funny movie once in a while. You know, that really helps. Plan your activities, delegate priorities, pace yourself so you're not doing all high strenuous things all at one time. And then occupational and physical therapies are really good too. Okay, another one of the treatment stage side effects is nerve and muscle. They are affected. You can have numbness and tingling of the toes and fingers. You can have difficulty picking things up, loss of balance, hearing loss, weak and tired and sore muscles, stomach pain. Again, you want to just really think of safety. Make sure that you're not handling hot or sharp objects if you're not able to lift it very well or you're not able to feel, with the sensations. Make sure your walkways are free of clutter so that you can help avoid falls. Provide support if need be. Use handrails and bath mats. A lot of these effects are usually temporary, but some can be permanent. Chemo brain is something that we just really learned about I would say probably in the last 2 years. But they have also found again that this can be a temporary thing as well as a permanent thing. Some of the side effects can include forgetfulness, unable to remember, confusion, trouble concentrating, taking longer to finish things. And again, what the caretaker can do is try to help by using a planner to help the patient to remember things that they need to remember. Also, good things to do is to exercise your brain with puzzles and crosswords and that kind of thing to help stimulate that brain to keep. It's amazing how quickly our brain cells can actually adapt. And so that's a very good thing to do all the time. You want to exercise your body, eat your vegetables, of course, because they have all the things in there that your body needs. You want to focus on one thing at a time sometimes because that helps the patient to focus in and on those things that are most important. And of course, always ask for help as needed. And this part here, I'm going to also say, not only should the patient ask for help as needed, but the caregiver should ask for help as needed as well. Also, tracking your problems in a journal is good, especially if you're just starting to have these problems or they're increasing. You want to be able to have the information to give to your doctor and be able to ask those questions. So, facing treatments can be challenging, and the more support, the easier it is to persevere. It can be a very big challenge, but it also can be extremely rewarding. The most important key, I think, is communicating, making sure that you're talking with your loved one and that you're coordinating things with the family and friends that also care. It involves a lot of different things, medications and managing side effects, reporting problems, and trying to keep loved ones informed of what's happening. It can also include helping decide whether a treatment is working. And again, keeping a journal, maybe if the patient doesn't keep a journal, maybe you want to keep a journal as how the treatments are working or what's going on, how they're responding to treatments. This is valuable information for the doctors as they can decide whether maybe the drug's dosage needs to be adjusted or changed or increased, depending on how the patient's doing. Okay. Now, survivorship is the third stage we were going to talk about. So we've gone through 3 stages now. We've talked about the diagnostic stage, we talked about the treatment stage, and now we're just going to do a little thing on the survivorship stage, which is really a more new thing because our patients are being are getting treatment. They are living longer with cancer, or they're living longer, maybe they're beating the cancer. But sometimes that stage brings a lot of new challenges, such as, well, how do I assimilate back to normal again? Now my life isn't revolving around treatments all the time. Now my life is supposed to be more normal, but what normal can sometimes be a step-by-step process to try to figure it out. Sometimes uncertainty happens, and especially continues with the concerns of recurrence. Recurrence, as they say, is one of the most stressful events in the course of illness for both patients and their families. So knowing this too, it's important to know that if you do face that, you need to get extra support around you to help you because it's very stressful. But it can be also a time of celebration. And I think it's important that we each learn to live each day at a time. And I'm going to go back to that thing again, too, because, you know, a survivor is an excellent person. You know, they say that we really empathize better when we've actually gone through what someone is going to be going through. And so when you get to the survivorship stage, if you can find out how you can give back to those that can benefit from your experiences, that is a real good turning point in helping you to become more productive. Okay, the terminal stage. Again, the terminal stage can be very difficult because you feel like you know, you lost the battle. It can feel like, again, you're out of control, that things didn't go the way you wanted it to go. But it also can be a very good time in that, you know, your goals focus, your main goal as a caretaker is to just make each day as comfortable as possible for the person that you love. Make sure that you bring as much comfort in as you can, alleviate the needs, and help with the sharing of feelings of grief and loss with, you know, at that stage when you know that things aren't going well. This is a good time to make sure that closing remarks are given. And one of the things that that can be helpful too is have people come in that you want them to be able to say goodbye to the patient at this time, and really be able to just, maybe they're not going to say goodbye, but have them come around while the patient is still with you and actually can communicate their feelings. That's a very good thing to have happen. There's also music therapy, which is very nice. You can have harpists come in, and it's a very nice time. You can also have hospice services. This is an extremely valuable service because they really do know a lot about this time. They have extenuating support services, people that can come in and talk to you, people that can help you take care of your patient, your loved one. And it's a great support for the caregiver at this time, too. Often, throughout the whole thing, too, all of the stages, having spiritual support is really critical. And I think at this stage of the game, it even becomes more so. But it's nice if you can have that as an ongoing support throughout the whole thing. Again, encourage the patient to verbalize feelings and be an active listener. These are journeys of life that take us in places we don't always understand, but by realizing these experiences can and often do make us stronger as individuals. And they enable us to help others on their journey, and that can make us better people as a result. Okay, so for the patient, we want to listen for the needs of the patient, take your clues from them, and find out when they're ready to talk. And be sure that they know you're ready to talk about anything. We kind of mentioned this a little bit. If they want quiet time alone, time with family and friends, watch a funny movie, talk to someone, maybe to talk one-on-one or have more people. And I always think, too, that's really good is that, you know, when I first started working in just a cancer hospital, it was kind of discouraging at first. Not that patients didn't have good outcomes, but it was just different for me because I had more of a mix before. And but what I realized was that each day when I go in, I can help make that hour or that day or that morning or that afternoon better for that person by being there in some way. And that might be establishing or, you know, just achieving a short-term goal. Maybe it's controlling the nausea. Maybe it's controlling the vomiting. Maybe it's just hearing the patient, sitting with them, or finding ways that we can meet their needs somehow. So it doesn't have to be a big goal. It can be short-term goals. A wonderful movie I think that everyone should watch that is really wanting to be a better caregiver is A Walk to Remember, because it really shows a lot of things about goal setting. It shows about coming beside someone, and it can be a journey and a learning experience for both the caregiver and the patient. As a caregiver, acknowledge your own needs and take the time to take care of those needs. Reach out to others when you are the caregiver. Reach out to others because when you are the caregiver, you also need added support. That's very, very critical. So some of the things that people can do to support either the patient or the caregiver is volunteer to stay with the patient on a regular schedule so that the caregiver can actually have a chance to plan the things they want or need to do. Offer to do the shopping or drive the patient to their appointments. Make dinner for the family. Bring in flowers for the family to enjoy to uplift the spirits. Take children to the park on an outing, or give the caregiver time to take the children on outing, especially if it's a spouse of someone that is having trouble with cancer. It's nice for the spouse to be able to just get away with the kids. Listening to the caregiver is also important. Be optimistic, but don't dismiss concerns as not valid. Since there are so many areas to coordinate and keep track of and problems to solve and added responsibilities, it's important that family and friends realize that because the primary caregiver is doing so many things, they need that support. So for review, we talked about taking care of a loved one with cancer, what to do for the patient, what to do for the caregiver at the different stages. And the stages we talked about, again, were the initial diagnostic stage, the treatment stage, the survivorship stage, and the terminal stage. And these are some resources that I'll leave up for a few minutes, and you guys, if they're good places to look for information. The National Cancer Institute has free resources, and also the American Cancer Society down here at the bottom. If we view this as part of our own journey, we learn and we share and we laugh and we cry, learning as we go. And as a result, we cherish life and quality life. Okay, that's it. Dr. David?
I'm sure there are. I mean, we've had people who have stayed. We have not lost a single person. So apparently this, I mean, I tell you what, this is a masterful presentation. I have never really, truly, ever heard a presentation that covers the nitty-gritty the way you have. And so I thank you so much, Terry, for this.
Oh, you're welcome.
I think this would be very, very helpful, even as an audio as well, because when I think what people need, especially when they're hit, and that's really how it sounds like. It's like a major impact to hear from their doctor, you have cancer. And at that time, they're not thinking that, I mean, they're probably totally disoriented, and they're struck down by fear. And so the loved one really is the one that needs to take charge. And having knowledge like this and being able to listen to and watch a presentation like this really does equip the loved one with the tools that he or she needs to take care of the cancer patient who has just been pretty much demobilized by the news. And there's so much to. Did I say demobilized? I meant immobilized. But I think this is so important. And thank you for these resources as well. So cancer.gov and cancer.org are two great websites they can go to. And I know that there are some hospitals that really focus on the spiritual and emotional components as well as the nutritional components that they bring along with the treatment. I think that's important as well. Social support. What is there? Is there something to be said for group therapy, for being with other people, kind of like the way Alcoholics Anonymous or Weight Watchers do? Is there something that can be said for cancer groups?
Yeah, I think it's really. We are. It's important for patients to be able to have that community that they can go to and not feel like they're. I think too, sometimes people are afraid of cancer. So when they find out someone has cancer, they kind of just go and don't want to really go close. And that can be a problem because, so that's why dealing with your own feelings first is important. It's not contagious. It's not something that, you can catch. And it's something that, it's so important for people to get together with their loved ones. And then also it's good for other cancer patients to talk to other cancer patients and to see what's working for others as well. Right,
absolutely. All right, folks, if you have any questions, please go ahead and type them in the blue box, in the blue panel, floating panel to the right of your screen. And I'll be asking them from this side. Well, we're yet to decide exactly what we're going to do with the recording, but I think it's been an excellent recording and very, very helpful for people. We also have other similar recordings that you can also share with your loved ones on, like Bernie Siegel's presentation on the spiritual and the mental components. I just want to also remind you that these webinars will be 3 webinars, weekend webinars. We've been playing all weekend. They will be available till midnight tonight. So if you want to catch them, go ahead and do that. Dr. McAnally's presentation will be on tomorrow. And I kind of mentioned that. He's talking about periodontitis, which is the most common disease known to man. It's something that happens in the mouth, in the gums, the teeth. and everybody has it to some extent. But it becomes worse, and mucositis is an inflammation of the gums, especially in cancer, when during the treatment, as Terry so wonderfully put it, that these treatment can really cause damage to the mouth and make your life really miserable. And Dr. McNally will be talking about some of the things that you can do for that. His technology has aloe in it, which has been proven for thousands of years as a healing mechanism, and he'll be doing the presentation with Dr. John Hall, who's a dentist. Well, I guess we have some. If you are not a member, you want to take advantage of the resources available. There's just a monthly fee that is required. You can call us or email us about that afterwards. Okay, let's check questions. I gave people some time to ask questions. Well, apparently there are no questions as of yet. So you've done an excellent job. That's what it says.
All right. Well, thank you very much.
Thank you, Terry, and we will be talking soon. All right, folks. Thank you so much. We appreciate you joining us, Terry. Again, this is great work you're doing. God bless and have a good night.
Thank you.